Today I'm going to complete a head-to-toe assessment on Mr. Crawford. Mr. Crawford has already gone to the restroom. He's changed into his gown. His vital signs today, his blood pressure was 132/78. His heart rate was 72. His respiratory rate was 16. His temperature was 98.2. His height is 6'1" and his weight is 245. The first thing that I'm going to do is just inspect his eyes, his ears, his face, and his head. His eyes and his ears are evenly symmetrical to his face. His eyelashes are present. His eyebrows, the hair there is evenly distributed. His facial hair is well grown. He does not have any hair on his head. So the first thing that I do is just palpate the regions. I don't feel any soft spots or any tenderness. I'm palpating his lacrimal apparatus. I'm checking his facial bones, his sinus region, and his transmandibular joint, and I don't feel any type of tenderness in that area. So the next thing that I check is his conjunctiva. So I need you to look up to the left, look up to the right, look up to the left, look up to the right, and that's clear. I'm going to do the cover-uncover test next to check his pupillary response. Consensual, direct, consensual, direct. So the next thing that I want you to do is just follow your eyes with this pen light and let me know when you see double. Okay, very good. Next thing that I want you to do is close your eyes. Let me know if you feel something hard or soft.
Soft. Hard. Hard. Soft.
Okay. I'm going to check your nostrils next. Here I'm going to make sure that it's patent, that the mucosa is moist, and I'm trying to visualize your turbinates. Okay, no problems there. Okay, everything is patent in both his nostrils. I'm going to check the inside of his mouth right now to check his hard and soft palate, his gums, his tongue, to make sure that there's not any lesions, to make sure that his tongue is symmetrical, that it's pink. I'm trying to visualize his tonsils and his ulna at this time. So, look at your gums and your teeth. You have any loose teeth? Okay. Thing is pink right now. Hold your tongue up to the left, to the right. And there's no lesions under his tongue. Hold your tongue up for me. Say ah.
Ah.
Okay. Now swallow. Okay. Now I'm going to continue to palpate, feel for any type of enlargements in any of his lymph nodes, in his cervical and his clavicle area here. I don't feel anything at this time. I'm going to palpate his carotid artery. Then again on this side. I'm going to listen to it as well. And then his thyroid. Don't feel any type of jugular vein distension. His your esophagus here is midline, and there's no type of deviations there. So the next thing that I'm going to do is check his back area here. Check his lung expansion. I'm looking at his skin here. It's warm and dry. I don't see any type of lesions or any type of problems with the skin. I'm going to check his lung expansion. So it takes a couple of deep breaths. Okay. They're moving symmetrical. Just breathe normal. Repeat after me. 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay. Go here to the front side here. Take this down. I'm going to check your expansion. Okay. Now repeat after me. 99.
99.
99.
99.
99.
99.
99.
99.
99.
99.
Okay. I'm going to palpate your cosvertebral area here. There's no type of tenderness there. Now I'm going to percuss back here. Take a deep breath and hold it. Now put your hands over your stomach and go forward. You can breathe. Okay, you can back up. Now put your hands over your head. Okay. Okay, your hands down. Oh, now I'm going to check your diaphragmatic excursion. So take a deep breath and then hold it. Okay, now breathe. Okay, take a deep breath and hold it. Breathe. Okay, now take a deep breath and hold it. Okay, breathe. Take a deep breath and hold it. Okay, now breathe. Okay, there is a 2 centimeter difference from your left to your right. Now, breathe for me. Breathe. Hands over your head. Take a breath for me. Okay, hands down. Okay, take a breath. Breath. Now I'm going to palpate your ears here, feeling that outside of your auricle. Doesn't feel anything there. His skin is still warm and dry. I'm going to take a look inside to make sure everything is patent, and I can see your tympanic membrane. Okay, everything looks good on that side. Check this side over here. Okay, everything looks good on that side. Now I'm going to close this one side of your ear and then whisper after me. Well, repeat what I whisper.
99. 86.
Okay, now I'm going to check your air conduction. I'm going to strike the tuning fork, and I want you to raise your finger, and when I place it to your mastoid bone when you no longer hear vibrations, then I'll put it to the front and raise your finger again when you no longer hear vibrations. Try it again on this side. Okay, and again. Okay. Okay, now I'm going to feel for your pericardium area here. Checking for any types of pulsations, lifts or heaves. Now lean forward. Okay, now go back. Okay, listen to the aorta. comb on it. Herbs, point, tricuspid, and then the apical. Okay. Now, you could just lie it down for me. Okay. Now take a deep breath and hold it. Put up. You can breathe. Begin on this side of you. Take a deep breath and hold it. Now roll over on your left side. Okay, you can lay back flat. Now I'm checking both his arms, warm and dry, his shoulders area here. Feel for his radial pulse, his brachial. I'm also feeling the lip nodes in his axillary area. Do the same thing on the other side. Just going to feel his arm, his shoulders. Feel his radial pulse. And then his brachial. Then I'm going to palpate his axilla, lymph node area here. Okay. Just going to take a look at his abdomen area here, checking for any type of pulsations or herniations. I don't see anything at this time. Bend your knees for me, and then lift your head up just a little bit. Okay, there's no type of rigidness noticed to his abdomen muscle area here, so just lie back flat, put your legs back down. Just going to auscultate in all 4 regions. Vowel sounds are present. Do his aorta, his renal, iliac, then his femoral, now I'm going to do a soft palpation. See, looking for any type of rebound tenderness. And then a deep palpation. Feel the pulsation of his aorta. Okay, I'm going to palpate his spleen area here. Deep breath. Let it down. And his kidney. On this side here too. On his liver. Deep breath. Let it out. His kidney area here. And then his gallbladder. Now I'm just going to percuss the spleen area. Can you lift up just a little bit for me? Right there. Okay, lay back flat. Then over his liver area here, palpating. Okay. Can you sit back up for me? I need you to move your head from side to side, front and back. Okay, and then like this. Okay, shoulders up and down. Okay, put your head up against my hand on this side. Okay, his muscle strength is a 5 and he has good range of motion in the cervical area. Now that I'm going to do is I'm going to check your cranial nerves. We don't have to check your cranial nerve 1. That one is for smell. But for your cranial nerve 2, I need to check your optic nerve and your optic disc. If I can get this to turn. Give me a second. There we go. Finally got it. Check the light source here. Okay, check this over here. Your optic nerve and your optic disc. Okay. Cranial nerve 3. Consensual. Just look straight ahead. Direct. Consensual. Direct. Cranial nerve 4 and 6 is your 6 cardinal areas of gaze. Okay, cranial nerve 5. I need you to clench your teeth. Go from side to side. Okay. Cranial nerve 7 is facial. The smile, frown, puff your cheeks, lift your tongue out. Bring your forehead. Cranial nerve, which one is it? 7. Cranial nerve 8 is your hearing, which is your whisper test.
99. 86.
Okay, cranial nerve 9. I just need you to swallow for me. Gag reflex. Okay, open your mouth. Say ah for 10.
Ah.
Okay, and we just checked cranial nerve 11. Hold your shoulders up and down. Okay, and then 12. Stick your tongue out. And everything is midline there with this time. Check your reflexes here. Sorry. Now I'm going to check your check your Achilles. And your Achilles. Take your socks off and I'm going to check your pulses. Okay, and your pedis. Tibia. And then your popliteal. Same thing on the other side. Your sock off. Check your pulses. And your pedis. Your tibia. And then your popliteal. Okay. Now would you close your eyes and touch what I touch? Okay. I think that concludes our test. Thank you.